Greetings, this is Dr. Nick Kouchis. In this video, I'd like to show you how to locate and then needle on a live model the body and head points that are part of the calming and centering treatment. To review, for the calming and centering treatment, we have 4 body points, also referred to as the 4 gates. There are 2 points in the hands, which are called large intestine 4 or LI4, and 2 points in the feet, which are called liver 3 or LR3. The additional 2 points are in the head. One, governor vessel 20 at the very top of the head, and governor vessel 24.5, which is in the midline between the eyebrows. Here is an example of the anatomy underlying large intestine 4 in the hand. As you can see, the point is located in the interosseous muscles between the first and second metacarpal. The first picture on your left indicates where the nerve plexus, the autonomics, innervate this area. The middle picture shows you the proper needling location overlying a skeleton. And the picture on the right shows you how this can be placed with the skin intact. Here is a demonstration of large intestine 4 being needled. We will identify the point. If you bring the first and second metacarpals together, you'll see a mound of muscle. Right in the middle, you could place the guide tube and then with a brisk tap, insert the needle through the skin. Then you advance, rotate slightly until that sense of dai chi is felt by your patient. Here's another example of large intestine 4 on a live model. Once again, you identify the second metacarpal, followed by the first metacarpal, and then that interosseous muscle in between, trying to palpate as proximal of muscle tissue before it becomes fibrous or ligamentous. So right there is a good location for needling. Here we take the guide tube with the needle, place it in the proper location where we want to insert the needle, remove the wadge or chad, then press briskly on the needle to insert it through the skin, reposition the needle, and advance it through that subcuticular tissue until it touches fascia or the first few muscle fibers, and rotate to achieve that sense of dai chi with your patient. Next we see the feet points, liver 3. To the left you can see the nerve innervation of the space between the first and second metatarsals. In the middle image you see the space in between the bones where the needle tip will be located once it's inserted. And in the right picture you could see with the skin the insertion point between the first and second metacarpals as proximal as you can where there's still a muscular tissue and it does not feel fibrous or firm. Here is a demonstration of liver 3 being needled. Once you palpate that most proximal muscular space in between the first and second metacarpal, you position the guide tube properly, press the needle in, and then advance 1 or 2 millimeters at a time, rotating until a sense of dai chi is felt. Here's another example without the markings on the skin for needling liver 3. Identify the first metacarpal, identify the second metacarpal, palpate the musculature in between those 2 bones for the most proximal musculature that's still soft and pliable. Position the guide tube over this spot. Remove your chad and press briskly on the needle to insert it through the skin. Advance the needle perpendicular, oscillating every millimeter until that sense of dai chi is achieved. Let's now look at the head points. We have governor vessel 20. Governor vessel 20 is identified by going through a line from the base of the lobe through the very top of the helix, where it advances to the very, very top of the head in the midline. And overlying this part of the skull, there is a depression where the sutures meet with the midline. That would be governor vessel 20. Governor vessel 24.5 is located also in the midline, in between the eyebrows or glabella, as you can see here. Here's governor vessel 24.5. You will first identify the glabella in between the eyebrows and make sure you're directly in the midline. And as we mentioned earlier, this is a needle you're going to insert at a 45 degrees. With your non-needling hand, you can pinch or wadge the skin to remove it from the bone to give a little bit more room to insert the needle. Now you wadge the skin and secure the guide tube. Remove your chad, letting the needle tip rest up against the skin, and then give it a brisk tap to insert it through the skin. Once you remove the guide tube, you could advance this needle until it touches the bone of the bridge of the nose or the glabella. It's not uncomfortable to have that point touch the bone. To needle governor vessel 20, in this circumstance, you're going to follow a line going through the lobe, through the apex of the top of the helix, all the way to the midline. And when you're at the midline, you'll palpate for a small divot or depression. Once you've identified that, secure the guide tube into that point, remove your chad, and insert the needle at a 45-degree angle. In this circumstance, it's going slightly posteriorly. And that also approaches bone.